And we don't quite have as much time as we hoped to talk about some of the discussion points which came out of yesterday's meeting, particularly the workshop we had. I've got one slide, which I'll show in a minute, and possibly people from the floor may also raise issues. I think this meeting's been very good, apart from the fact everybody sits on the right-hand side. So poor old, which I haven't been able to change that pattern of behaviour. Haven't been able to change that pattern of behaviour. But poor old Kerry probably actually saw Vitali and two other bald heads actually, including mine, attending, and didn't realise you were all there actually. No, nevertheless, I think actually this has been very helpful at re-energising us and reactivating us. I think though to take this forward was more than just continue doing what we're doing, which is good and positive. We need to actually develop 2 or 3 little kind of action groups of people who take some of the ideas forward and make them happen. So rather than just coming back in 12 months' time and saying this is still an important issue to me, if people really would like to actually generate a group of 2 or 3 people to take things forward, please contact me, and I don't mind speaking to people or tapping them on the shoulder or requesting that they link up to do that. I think the second thing we need to do, almost as Ben was indicating, is to get things done you need to have money, right? We have a small amount of seed funding. We can do positive things with that, and it's good to hear that positive things have happened. But what you want to come out of that is then larger grant applications. So for those of us who feel, we've just got over the grant season, how could you even think of another grant? And I noticed that Jamie's gone to start work with Angelo on our next grant application. But now is the time to think about what you would want to do next year, really. And so I know there have been discussions about whether we should be putting in a strategy grant and how to actually generate that over the next 6 months for next year. That's the kind of thing we need to be thinking about now. So those 2 things. One is, if a particular research interest, let me know, let Chris know, get together a small group of people. Chris can help organise meetings. If anybody wanted to have a workshop about something, we would again facilitate that. So if you said, I would like to get the 2 or 3 people in the CRE who are interested in this, have a workshop, we'll do it at whatever time zone suits the person overseas we'd like to contact. Again, we can facilitate that. So, or if someone said, I want to have a workshop next year when we can all travel around Australia freely and not be worried about a lockdown in Victoria, that we are happy, to put up the small amount of support to do that. So in other words, that's a bit over to the membership of the CRE to say, this is now what I want to do, what we want to do. Can you help us do that? And I'm sure Chris will help you, but we will help you, right? So I'm sure the executive committee. So and then think about that for next year. How do we actually get the next date? And the relevant thing is we do have funding for 3 postdocs, and we'll be advertising we'll be getting people in July. We have within our CRE plan, we do have a plan for postdocs in particular position. And in a sense, last year would have been a difficult time to start, but next year will be a great time for postdocs to start. So we do have 3 of these. We'll be talking about them, and we want people to think about that. Greg, did you want to say something? A proposal, right. So if someone said, listen, I want to use all of the CRE's money to do this thing, which is going to make a huge difference in TB, well, maybe that's what we should do. But we need to be proactive and optimistic. Yes, Greg.
So, I mean, just following on from what you're saying, you recall at our last CRE meeting 2 years ago, I flagged the idea of the synergy grant, which is what you're just saying now.
Yeah.
And what I would I guess put forward here is I feel like from today's and yesterday's sessions, there's a few components of different aspects of TB control, which I think are now at a sort of a stage where we can start to put them together. And I think we've heard about the importance of multidisciplinary ways of understanding implementation. So as we talked about a couple of years ago, what I think we should do is put together a synergy grant around translating individualized patient care into high burden settings. And by that I mean bringing together individualized use of molecular diagnostics, pharmacokinetics, understanding the way that we use our MDR treatment algorithms, and also a qualitative understanding of patient factors and health system factors. So there's a whole lot of a breadth there of what I've just described, which requires multiple skill sets and multiple locations. And so what I would propose is that if anyone's interested in that as a concept that we hold separate from today, maybe a couple of hours, webinar meeting in the next couple of months towards putting together such an application. Synergy grants take literally 6 months to put together. They're like putting together 10 investigator grants. It's a lot of documentation, but I think the CRE is really ideally positioned to be able to put such an application in.
Now, just to show you that this was, and I hadn't spoken to Greg about this, but from our discussions yesterday, these were just 5 points which came out of really what was about an hour and a quarter's discussion, which were raised by different people. The lack of point-of-care tests for TB, whether that's ever going to be possible. Greg is a member of the point-of-care CRE based at the Kirby. And out of our discussions around tests is actually the validation of new diagnostic tests, which actually requires sites both in low-burden countries and high-burden countries, because they both tell you different things. And we've had some links with FIND, and we also will have more links with FIND in the near future. And this requires well-defined clinical and community cohorts. And we've got a couple of these, but we maybe need to get a couple more. So we should be thinking about how, in collaboration, we could develop improved cohorts. In other words, thinking a bit more strategically, not just doing the research which we're interested in now, but which will actually lead to new opportunities. And the second point, which has come out of multiple talks, actually presented, even what Kerry was talking about just now, upscaling of the implementation of the approved guidelines for LTBI therapy. But one point which has come home, I think, from the VQueen study, but also some of the other studies, that in fact the contact tracing which is done as a preliminary to treating LTBI was also yielding between 2 to 3% of new cases, and which again is not always well recognised. A third point was operationalising, terrible word, but in fact putting into practice the research findings. And again, Kerry raised this around one of the points which came up in our discussion yesterday was around the certainty of diagnosis. And as Simone knows from China and from elsewhere, it is one of the dark secrets of TB is that about 2/3 of people being treated in the world for TB do not have a definitive diagnosis. They're being diagnosed on clinical TB, either in the absence of tests or the fact that the clinicians don't trust the tests, and that is happening around the world. And people are getting better, as Simone said, their x-rays improve, and yet that is often left out of the groups of patients who are reported in clinical studies. MDR-TB, the use of whole genome sequencing. And that's a little bit links to what Greg's talking about in personalised care and TB, and I think someone raised at our meeting yesterday, it might have been you, Ellen, that even around Australia, what patient-centred care means varies greatly between the different jurisdictions. So it varies a lot in Australia. So how does it vary throughout the world? And you could actually, so you could have a synergy grant about applying this in high burden countries, and you could have a partnership grant about applying it in Australia in partnership with health services. And if you had such a grant across 2 or 3 jurisdictions, apart from the fact that people reviewing the grant would be surprised that people are actually cooperating across these, it would be quite powerful. So you could actually be doing the same kind of thing, one in a high burden country, one in a low burden country. If Guy was here, he would be talking about the optimal methods for active case finding. And as we know, Guy has demonstrated and is really, I think, really will emphasise, until we're finding the TB cases, we won't be controlling TB. We now have 3 ongoing studies in the CRE using overlapping technologies. This is actually very powerful. But I know Guy would be thinking about how to be doing this in an even more ambitious way. And we'll throw in one at the bottom, is that for a number of years now, at least 5 years, we've been complaining to the Gates Foundation about how TB vaccines, the new TB vaccines, are all being tested in Africa and not in Asia. And there was a little inkling around December last year that this was being recognised when Guy was approached about thoughts about a TB vaccine testing site. It would be great if we could develop this in a collaborative way in our region, in Indonesia or Vietnam, supporting them. And these were 3 points which actually came up in our discussions. I think that Rick made the point that the research questions vary quite differently in different parts of our region. And in the Western Pacific, they vary in different island states in the Western Pacific. And in a number of cases, there's a strong need for implementation research to support the national program. And it was emphasised the importance of understanding the setting, and from what Angela told us about Papua New Guinea as an example, and I think that also is reflecting elsewhere, that the importance of qualitative research. And then point 3, understanding the implementation gaps and the capacity in health services research, or the abilities in health services research, may be different to what we normally do in our research methodologies. And again, this would be very relevant to either partnership grant or a synergy grant. And how you frame the research questions, we all know, does depend on how the research funding is being offered. And we need to be opportunistic, and internationally, through DFAT at the moment, as it was emphasised, health security is the flavour of the month, but we can use that opportunistically to answer other research questions. And finally, I think a helpful point was made that clinical trials might go for 5 years, or in the case of the practical trial, it was going for how many years, even many more years, a long time. But nevertheless, they come to an end. The research grant runs out, the PhD gets written, the postdoc moves on, but the national TB program is left holding the baby. So we can be doing research, but it is time limited, time bound. So in each of this research, how do we strengthen the local national TB program through this collaborative research? So if we could wrap up those 3 practical questions in answering each of the 5 points, I think we would have a very powerful platform. So I'm not quite sure if anyone else has other ideas. I think we're nearly finished.
Now, Warwick, I won't share Group 2, but Michaela made notes. There's lots of overlap with what Group 2 decided, but we will share that with Chris, so we can pull all of this together and maybe share it with the whole group for input.
Have you got a slide?
But that's fine. No, we don't have to. I was just wondering whether there was any value in maybe some type of formal CRE endorsement for the synergy grant idea around personalized medicine, and for Greg to lead that, and to also offer this, to think who could potentially, if there is interest in leading a similar Australia-focused partnership grant. But if that sounds like a very practical outcome, which we've
slightly different, you know, the whole genome sequencing guided therapy in Australia and doing that across the jurisdictions is such a powerful hook to hang out on,
Yeah.
locally. So they might have slightly, not saying Natalia, you have to stop doing COVID work, come back to your real roots of tuberculosis. But so, Michaela, did you want to add anything?
I think Steve's in a better position to add something.
Am I? Yeah, okay. I will just, one specific one, number 5, speaking to that one, the first thing came up was the fact that we need to perhaps think about vaccines in different populations beyond newborns, young adolescents, etc. So that was one example of overlap, yeah.
Well, Philip Hill was going to join us for some time, but I can't imagine that he's still online now. But as I was saying to you yesterday, Jamie's and Claudio's vaccine, or we should say Claudio and Jamie's vaccine, of the BCG COVAC, which stimulated both innate and adaptive immunity to both those pathogens. That'd be a fantastic adolescent vaccine in healthcare workers entering nursing training in Bandung, which is exactly the trial that Philip wants to do in Indonesia. And it would be an ideal vaccine for boosting immunity for people entering healthcare. So if we can get a phase 1 study done in Australia, I think that would be a great phase 2 study. If we have any volunteers who want to come and help implement, not for the vaccine, I'll do that. I'll be the volunteer for the vaccines.
Warwick, Philip also just had a comment on the personalized care thing. It's something that he's been thinking about for a while as well, and was
yeah, just pre-warning, some people in the room might get tapped on the shoulder to help out, because potentially a big ambition. So with Kerry Viney, we've been putting together a perspective piece on person-centered care. And one of the main things that came out of putting that together was that there were so many different ideas about what needed to improve and be looked at, including research on person-centered care, that actually that could be unpacked as a supplement rather than a single article. And there's interest from WHO and TDR to look at commissioning a supplement on this this year. And so there would be a number of aspects, from taking further some of the ideas on, you know, really targeted, individualized care, through to what does TB and disability with a person-centered approach really look like in terms of programs, as just 2 examples, but there is probably at least 10 articles to be looked at. So just a pre-warning.
The other thing that our group, I think it's correct to say, 1 and 2 took up quite a lot of attention because of that issue around, I think we all recognise the value of contact screening for case detection, but it's about better targeting how we can prevent treatment in those contexts, particularly as we move beyond the under 5 focus, and about, you know, Katie and others were saying we really need to identify better the ones who are going to benefit from these interventions.
And the best way to do that, the one thing I've learned from Guy, is to actually come up with a hypothesis. Doesn't have to be perfect, but then test it in a trial. And by testing in a trial, if you've designed the hypothesis correctly, as Guy does, you come up with evidence that changes policy. But if you don't, even if the trial itself doesn't come with the answer, the process of that actually, defines the problem better in the environment. And then it becomes a more iterative approach. But if you just keep doing it as cohort studies alone, it doesn't move forward as much. And I think, we have abundant capacity here and in our various institutes or universities where we can pull people into the important disease of TB and control. Other comment? Michaela, did you write anything else down? Other comments or thoughts? Yes, take the mic. Rick.
I think for years I was involved with the RGLC and visits to different countries and all of that, and very important in terms of establishing trust and that between the countries in the work that you do. And in the last 2 years we've been forced into sort of doing Webex communications rather than the face-to-face stuff, and just wondering whether, and in a way this is sort of a hybrid of we're here and they're there sort of thing. But I think that you spoke in number 3, or we spoke in number 3, how can we continue the research? The PhD student finishes and it all falls in a hole. But just wondering if we look at how can we, lessons learnt in terms of conducting Webex meetings and the communication that can go on to complement face-to-face or lack of face-to-face activity to sort of help just slowly build those aspects, the education, the research.
And that's actually is a lesson from COVID, isn't it? I mean, we all might get a bit sick of the 5th or 6th Zoom meeting that day, but the capacity in to be able to have meaningful meetings, particularly with groups of people who've already met and know one another, and there's an element of trust. And so the capacity actually, to move beyond making, we might do the 3-year study, but the 3-year study is part of a continuing support and structure. Ben, anything else?
No, I'm
okay. Well, listen. I think we probably have come to time. It is 20 to 5. So thank you very much for staying. And if there's folk online, I hope there might be 1 or 2. Carrie might still be with us in Geneva. Yes. We really do enjoy having you with us. I'd like to particularly thank 2 people. I'd like to thank Armen, who's there, and we should also thank... And our AV providers have been fantastic, and I think have actually provided webinars that work. So thank you very much. And I especially like to thank Chris, who I think has really put in a huge amount of work in getting this up and has really proved to be tremendous help. So thank you. Stand up. So I've just given Chris now a whole list of things to do. She will organise the special interest groups of the CRE and organise your international collaborators to join you at appropriate times, and then organise your morning and afternoon teas, and also for the Synergy Group application for next year, we'll also facilitate that. So thank you, Chris. Okay.